welcome to Tech Talks, the People and Planet podcast. On today's episode, I'm joined by Jeff Glueck, the founder and CEO of Salvo Health. Hi, Jeff. Nice to meet you. How are you?
Great to be here, Lee.
Thank you so much for joining us. Now, Jeff, this is all about GI health, isn't it? It's a huge problem. I'm based in the UK. We've just been speaking about it being a problem here too, and you're in the US. Tell us more about that problem, and you know, what's the mission? What's the inspiration behind it?
Well, gut health has become a huge topic on TikTok and on social media, and some people refer to it as hashtag gut talk. And yet there's been a shortage of really good personalized medical information that's of high caliber. There's a lot of misinformation or irrelevant information out there. And in the US, there's some 40 million people who suffer from just IBS, irritable bowel syndrome alone. And then you add in gut conditions like celiac or Crohn's and colitis, IBD, you add in GERD. You're talking about a third of Americans, and I would wager in the UK and Europe a similar percentage. Many people suffer through their lives with chronic symptoms of bloating or motility or abdominal pain or nausea and vomiting, diarrhea, constipation, all these things, or esophageal challenges like GERD or dyspepsia. And so this is a huge problem. And it also, not just that 1/3 of people who suffer from chronic conditions that aren't well treated, and we'll talk about why they aren't well treated or managed in our healthcare systems, but also, gut health also involves in gastroenterology and hepatology, the specialty medicine conditions that we often work in. Gut health also involves conditions like liver damage as a result of obesity. And so those are diagnosed by GIs, what used to be called fatty liver disease, but that's not patient-friendly language anymore. So now we talk about metabolic liver disease or MASH or MASLD, and obesity. And so these are conditions that GI divisions at health systems and GI private practices and hepatologists have to deal with, and we help them improve the care for these patients who suffer often in silence for years, who feel stigmatized, and it's hard to talk about. It's particularly a women's health issue. So many women's health problems suffer from gaslighting or not being taken seriously over the decades. And this is very true of a condition like IBS, where 2/3 of the sufferers are women, and particularly younger women. And they're, famously, the establishment can ignore self-reported pain that doesn't show up as an obvious thing like a cancer or a viral disease, and yet they're really suffering. And there are ways to help these people, but they involve comprehensive, personalized programs, and every person's journey is nonlinear and a little different, and that's how Salvo Health plays in this space.
Interesting stuff, and that's very interesting what you said about it's predominantly a younger women issue. 2/3, did you say?
Right, 2/3 of IBS sufferers, per the CDC, the Center for Disease Control in the U.S., are women, and it frequently starts in the late teens or in the 20s, and it persists for years. And so many health conditions like cardiovascular disease or diabetes tend to be things, type 2 at least, that we associate with older patients. That's not true of gut health. It sort of attacks everyone, older and younger alike. And between obesity and MASH MASLD, which affects almost 40% of Americans between them, and going towards 50%, and the third of Americans who suffer from classic chronic GI functional diseases, we're talking about an enormous portion of the population. They're not well cared for. They bounce around the system. They end up in the ER frequently, and they suffer for years. I mean, this is a very human tragedy, the stigma. We talk to patients all the time who, for instance, are young mothers who are afraid to go to their child's music recital because they can't be far from a bathroom, the young women who are afraid to go on a business trip or a business dinner or a date because of all the anxiety and depression associated with the uncertainty of their symptoms, and are just suffering. And the hard thing about conditions like these that are stigmatized and don't have an easy solution is that doctors tend to ignore them because there isn't a procedure or a medication they can just simply apply. And frequently, physicians in the US, where we have a fee for service program, especially a specialty physician like a gastroenterologist, where there's only 15,000 in the entire United States.
Really?
It's a lucrative profession if you are, and the system is telling you you need to do colorectal cancer screening all day long. It's highly remunerated to do screening on otherwise healthy people over age 40 or 45. That's very lucrative. And so the IBS patient, that 28-year-old woman who suffered for 5 years and can't go to her daughter's, kindergarten recital, that person is told, good news, we did the endoscopy and the colonoscopy and you don't have cancer. So you're all set. I have to go to my appointment.
Yeah.
And the woman, the patient, who could be a man or a woman or any age really, says, but doctor, I'm suffering. What do I do? What do I have? And they often are told, sorry, I got to run. Here's a brochure, drink some more water, or some other flippant answer. And you're fine. But you're suffering, and that suffering is not recorded. And we did some research that these patients, like, take a mid-acuity condition like IBS that doesn't get a lot of attention because there's not a pharmaceutical solution. Those patients in the United States average, according to a study we did with Milliman, the giant actuarial firm, $14,000 in annual expense, as opposed to $7,000 in total medical expense for the average American, let's say. So what that means is they cost double. And why do they cost double? It's not showing up only in visits to GI clinics, even though it's showing up in that 2 a.m. Friday night abdominal pain that turns into an emergency room visit and lots of expensive scans. It's showing up in mental health, where 75% of IBS sufferers also suffer from clinical anxiety or depression. We can come back to that topic. It's showing up in many other health conditions, autoimmune conditions, and inflammatory conditions that stem from poor gut health. And so, these things are important, but our medical system is not set up to look at you as a whole person. It's set up to, reward in-person appointments and procedures.
So this is obviously where Salvo comes in then. It's a huge, huge problem. Unwrap the product a little bit more for our listeners, Jeff. How does it work? How does it solve the problem that we've just talked about? What's included?
So what Salvo does is apply best practice, evidence-based, comprehensive care through your local doctor's office or clinic. So we partner with trusted local physicians, mostly private practices in the United States that are large private practices in gastroenterology or hepatology, but increasingly with obesity and weight management medical centers as well. And what we do is all the care between appointments or after procedures and after diagnosis. So we partner, you stay with your local physician, your trusted physician, you see that person as you always would a couple times a year for 10 minutes typically. But healthcare and health, more importantly, are really about not those 2 or 3 10-minute appointments. They're about everything that happens all year long. And so we take care of the other 363 days a year of support. And that involves assigning each patient a team that's multidisciplinary. So each patient gets assigned a team that is a nurse, and then either a registered dietitian or a behavioral health therapist or an exercise physiologist, depending on the needs of the patient. And they're going to work with that team every day, but asynchronously primarily. They'll have a monthly appointment by telehealth, but they get a personalized care plan that evolves each week that reminds them each day when they wake up and before they go to sleep what are the 3 or 4 things that we're working on this week for their condition, we'll get into that. That covers nutrition, brain gut therapies, cognitive behavioral therapies, movement, stress, sleep, environmental health, and other interventions. We have about 150 different interventions we work with patients on. And each patient's journey can be different. Each patient's problems are very much unique, and the best physicians actually work closely with the patient, trying a variety of evidence-based interventions to find the mixture that works for you. And so it's a journey, and you need an expert team that's listening to you. And we ask patients to be involved in their health. And so that's how the care works. It's between appointments, it's through an app, a team, and it's billable in the United States to insurance under codes like remote patient monitoring or chronic care management. So insurance covers this for Medicare and commercial. And we're just trying to expand the number of doctors' offices that offer this wraparound care, as it's called, as a covered benefit. It doesn't interfere with their care, but it helps patients. It also generates ancillary revenue for the practice, improves outcomes. And these are busy physicians. They don't have the time or often the training in nutrition and behavioral health to handhold patients through comprehensive care plans. And it works. We can get into the research that we've published on it.
I was just going to say, and I think that's a really important point, isn't it? Because this allows for personalized care as well, because the symptoms and the solutions to these problems are very different person to person, aren't they?
That's right. It's very much about personalized, comprehensive care. I mean, this is really it sounds harmless. You know, we're providing a nutritionist, we're providing behavioral health support, cognitive behavioral therapy, but it's actually quite a radical prescription for what ails the health system. Where the health system is about episodic care, this is about continuous care. Where the health system is about silos of experts that just work on the colon or just work on your mental health completely separately. This is about coordinated interdisciplinary care, you know, and so where it's about inconvenient in-person appointments as the only way to receive support. This is about care when you need it each day, and so 7-day-a-week support. And you know, in other industries, we've changed things, right? Appointment primetime television, where you have to watch the show at 7 p.m. on a Thursday night, has been replaced by Netflix. You know, going out in the rain and hoping to find a taxi has been replaced by Uber. But still, healthcare is very much like, oh, you'll have to wait 2 months and have a 10-minute appointment after an hour in the waiting room. It's convenient for the health system, but it's not convenient for the working mother who has to get time off from work and take 3 buses and get childcare to go to that in-person appointment.
Like it. How did you arrive here then, Jeff? What's your background? What's your story?
So I've been a tech entrepreneur or executive for over 2 decades. I co-founded a company called Site 59 originally back in 1999 that was the lastminute.com of the United States. We later acquired lastminute.com after we were acquired by Travelocity, the global travel company. I ran product and marketing at Travelocity for about 7 years. We built that up from about 3 billion to 11 billion in global travel sales while I was there. I then became CEO of Foursquare, the global location technology company that powers location services for companies like Uber and WeChat and Snapchat and Twitter, now X, and many other leading tech companies, map services. And so this global location social network became very much a mapping and data science company under my leadership, and grew about 10x while I was CEO globally. And so I've been a tech entrepreneur and executive for many years. I always wanted to do something in healthcare. My father was a physician, and I grew up around hospitals. My dad trained at Mass General, and I was born in Boston. Grew up around hospitals in California, where he was a chief of staff, and I just saw that technology was not well used in my father's hospitals, and that's just true of the industry still today. I didn't become a physician. I became a technologist, but I've always wanted to contribute. And I also went through some experiences personally. My wife and I lost what would have been our first son at 24 weeks into a pregnancy. And there's a longer version, but it was an awful, awful experience and involved a lot of the things that are broken in healthcare. And I remember asking the OBGYN if I could take any solace that our loss might contribute to research to improve prenatal care. I asked, do all the outcomes and all the data associated go into a giant structured database where leading physician researchers and leading machine learning and AI experts might improve care, predictive care, and personalized care to improve outcomes so that the next couple didn't have the devastating loss that we did. And the OBGYN just said to me, "Oh, I wish that was how it worked, but that's not how healthcare. There's nothing like that." So I vowed that if I was ever in a position to launch a company that would do data-driven, personalized healthcare, I'm a machine learning data entrepreneur, that this would be something I would want to launch. And I got very interested after the birth of our twins through my wife's work at madesafe.org in understanding things like functional medicine and how our bodies are and our microorganisms, our microbiome are under assault in the modern world from all of these chemicals that are worsening our microbiome health, these processed foods, and our modern diet in the United States, particularly we've gone from 10% obesity to almost 50% obesity in the last 50 years. We've also had a 50% decline in fertility worldwide in the last 50 years. I mean, these are really concerning things. And as we learned about toxicology and endocrine disrupting chemicals and the like, became more interested in the leading physician researchers that were trying to solve these health challenges of the modern world, and there are solutions. So we put together Salvo Health to bring all of these comprehensive evidence-based practices that most patients just don't get access to. And by the way, it works. I alluded to that, so I'll mention we published at the American College of Gastroenterology annual meeting last fall research on IBS, which is a notoriously frustrating condition for physicians to treat and involves almost 10% of the population. And 84% of patients said the Salvo experience was better than any healthcare experience they'd ever had. They felt heard, they felt supported. 76% started feeling better after only 4 weeks of treatment, and these are people who had almost 5 years of chronic weekly or daily symptoms prior to beginning intake. So this is working. We also ran a separate study that was a 2-arm study, control and treatment arms. And we saw people who were in treatment, so proactively managing their conditions, used emergency rooms 79% less for GI-related concerns. And GI abdominal pain is one of the top reasons that people go to emergency rooms. So this is a really material change. They also used less mental health services. They used less primary care appointments because they were getting answers and managing their condition proactively and not at 2 a.m. in the emergency room, which is a terrible place to manage a chronic condition. So really it works. There's lots of research, but the system isn't set up to deliver that kind of continuous multimodal care. And we are.
And that leads me on to my next question, actually, because it's you shared that great evidence-based results with us, but it's rarely plain sailing with startups all the way through. I'm keen to understand what challenges you've had to navigate or are navigating to get where you are today.
Well, we're very much an early stage startup with big dreams, and change in healthcare, particularly in the United States, is very slow. And the pace that you want to work as a tech entrepreneur is not the pace that large health systems or even large private practices work. The sales cycles are slow. You have to really manage your burn rate. You can't go at the speed to reach all the people you want to reach as fast as possible. And we payers, in the US, we have private payers. We don't have national health insurance. And so they tend to be very interested in ways to save money, but they also move incredibly slowly and want years of data before they want to try things. Um, and so change happens very slow, and so you have to be patient and geared to survive, and prove things out piece by piece, and then build that flywheel. And so we're very early, but we're having great early results. And I mean, it helps. It's taken us a while to understand this, but when we go talk to large, medical groups or GI divisions, you have to pass the first two tests before you get to the third. So the first test is, will this be a profitable service to add? And the answer is yes. We can bill for this. It'll build revenue, and it's risk free. It doesn't cost anything. We take all the risk and all the expense up front, and they get profit. Will it free up my doctor's time, or will it use more of their time? And we answer 5 questions a week from the average patient. So we're taking burden off these busy physicians, and so it makes their lives better and their staff lives easier, fewer phone calls to deal with. So that's the second test. And it's only then when you really get to the real reason we're here, which is that it's better for patients. And everyone agrees that this is a huge gap in how care works today and would help patients. But they won't even bother spending a lot of time on it until you pass the first 2 tests. And so it's taken us a while to understand that. And now, now we're getting more and more traction, and we're proving it out. So it's really been key. Many healthcare innovations have happened through employer distribution, but that channel became very saturated. The employers only want so many benefits, and they're besieged by healthcare startups, asking companies to pay for these benefits. And so we really figured out that where the patients went in the system is to their local trusted doctors. They ask their primary care doctor, and their primary care doctor sends them to their local GI or obesity specialist. We're increasingly doing a lot of work with obesity, or patients living with obesity. And so those waiting rooms are full. And so that is really where the patients are, and they want that trusted local physician. But then that trusted local physician has very little time for follow-on care and handholding, and that's where we can partner. So this is working now, but it's taken us a while to figure out the formula, and now it's gaining momentum. But we're very early. We have big dreams on how this can change specialty healthcare, not just in GI, but in obesity, and then ultimately in other areas like endocrinology and fertility and women's health and the like, where this kind of comprehensive continuous care needs to happen.
Sounds like a really good time. And if the system moved as quickly as what you guys can, things could move. So it would be such an easier process. What's next, Jeff? What comes next this year? Anything that you can share that's exciting for the listeners?
Well, I think the urgency we are feeling in the healthcare world around these new anti-obesity medications, particularly the GLP-1s, is very much shaping our startup now. And so in the US, there's been a craze for drugs like Ozempic and Wegovy, Eli Lilly's new tirzepatide. And so these are incredibly powerful second-generation anti-obesity medications. But they raise a lot of questions. And simply the drug alone is not the standard of care. And so there's such a demand for these drugs, and they're even hard to get. They're enormously expensive, and they're not covered by most employers or health plans. And the reality is that a study just came out that 60% of patients don't even make it a year on these medications due to supply constraints or the $1,300 a month expense, or GI side effects or the like. And the reality is people lose 15 up to 22% of body weight on these drugs, but they lose mostly muscle mass first. And so you're having really severe side effects of loss of muscle mass, which means if you come off these drugs and your muscle mass is down more than your fat as a body composition question, well, what does muscle mass mean? And muscle mass is your metabolism, right? And your strength versus your frailty. So you have this sarcopenia problem where patients think they can go on for a few months, lose, 10 or 20, 30 pounds. But studies have just come out that patients regain 75% of the weight very quickly if they come off the medication that they've just spent thousands of dollars, either their employer or themselves out of pocket on. And so the solution to this is to do it right according to the standard of care, which is to have a nurse and a dietitian and behavioral health specialist working with the patient, using the medication as a springboard to change diet, to stop stress eating, to introduce exercise, to heal the microbiome, to fix sleep issues and movement issues and mental health issues, and use it as a flywheel to get going so that you have the option of coming off these medications and not regaining all the weight. And so there are proven ways to do that, and that's what Salvo does. So if you remember, we work with the physician, complement the medication with all of these lifestyle medicine and mental health interventions, and so that is something that the doctors are asking of us. And so we've launched those programs, and it's now more than, between MASH, MASLD, and obesity, that's more than half of our patient volumes now.
Oh, wow. Exciting times, Jeff. Thank you so much for joining us. It's all we've got time for. Guys, this is Jeff Glueck, the founder and CEO of Salvo Health. Jeff, thanks again.
Thanks, Lee.